Everybody's just quite scared about side effects, about vaccines, and this is one of the reasons that the pharmacists cannot cope with the side effects. And what can you tell me about this kind of things? Doesn't happen often in Canada about anaphylactic shock or.
No, I would say that it doesn't happen often. Obviously, it can happen. There is a very small risk of that happening, but it is part of the training for the pharmacist to know exactly what to do if that does happen.
Okay.
Yeah, so in pharmacies as well, it depends on the province what's mandated to be put in kind of your emergency box, but you always make sure that you have things like epinephrine or Benadryl available to you so that in the event of anaphylaxis, which as Selena mentioned is very rare, I've given hundreds of vaccines and I've never encountered one instance of it. And you just prepare yourself for the inevitable, and that requires also recertifying in CPR and emergency first aid every single year.
Okay, just one more question, because actually you are here in Poland for a reason. You are just actually teaching under one of the best brands of education programs in the world, Pharmacy Without Borders Canada. And actually I know that you just teach Polish pharmacists to do vaccines. Could you just tell your experiences for the last workshops that we just performed last week?
Yeah.
What do you think? They are eager to do it, or because everybody says in Polish media that pharmacists are not interested. Would you confirm that?
I mean, with our experience with teaching the students, I think initially there was a little bit of hesitation, but as they became more comfortable with it, they were getting more excited and more willing to learn and get more involved. So I would say that's not necessarily true. As with any expanded scope, there will be some initial hesitation, but I definitely saw a lot of enthusiasm and excitement.
Zest of energy in the eyes.
Exactly.
Basically.
Yeah.
And I think it takes a small group to create change. And so if you empower this small group that we see through this training program, and then they slowly start to kind of spread the word to their colleagues, having the conversation can foster the comfort and the courage to come forward and gain new skills. Because taking a needle and injecting it into someone is not kind of a skill that you would practice every day. It's new, it's scary, but as soon as you have the actual training to be able to do this, it's super easy.
Just my last question now, because a few months ago we had Regis Weilandcourt, Dr. Regis Weilandcourt here visiting Poland as well. And he told me also that actually when the program of vaccines was introduced in Canada, it actually increased the number of patients visiting doctors. So what can you tell us about that?
I think as with any change, like the public also might be slow to adapt. And so while we might be like the top 3 of most trusted healthcare professionals, we were the most top 3 kind of in soliciting information, but not necessarily encountering a procedure in the pharmacy. So I think over time that has changed, but it took a while to have the public also trust pharmacists in terms of having kind of any physical
and
interaction
that
with
you
them.
provide the service.
Definitely.
Yeah.
And I mean, it's hard to say whether the reason why they're seeing their physicians is because of the vaccines, but it could also be that we're in a day and age where patients are getting more involved in their health. So perhaps that sparked an increase in curiosity with their health, and they started noticing more things that they wanted to talk about with their doctor.
Excellent. One more question. I have 2 wonderful ladies who are very confident pharmacists from Canada. And what would be the last message that you could pass on Polish pharmacists regarding improving the scope of practice? Maybe you could motivate them in a way that it's worth and it's feasible.
Yeah, definitely. I think it's important to be confident as healthcare professionals. We are an important part of the healthcare team. So we want to make sure to collaborate with everybody, but also be very confident in what we know, because we can truly make a difference.
I think I would say that as a pharmacist, you are the medication expert, and you need to know and shout that from the rooftops that you're the one that can be the best positioned to advise on therapy and advise on what literature truly supports therapy. So moving forward, working towards more of a collaborative model, change is hard. You will encounter some pushback, but at the end of the day, as your practice expands, you'll be more satisfied from a professional standpoint, and you won't ever want to turn back.
Fantastic. Thank you very much for a chance to actually have this interview here in Poland. Thank you to everybody.
Thank
Thank
you.